Welcome to Fibroid Awareness Month 2023. Our program is the Black Maternal Health Crisis. Our program today is focused on Black maternal health. The Centers for Disease Control data shows that Black women are 2 to 3 times more likely to die from pregnancy-related complications than white women, with most of the maternal deaths being preventable. This risk spans all income and education levels. We will open our program with a statement from Congresswoman Robin Kelly. Congresswoman Kelly serves Illinois' 2nd District. She's a strong advocate for women's health, and in 2021, Representative Kelly introduced the Black Maternal Health Omnibus Act of 2021. This bill directs multi-agency efforts to improve maternal health, particularly among racial and ethnic minority groups, veterans, and other vulnerable populations. It also addresses maternal health issues related to COVID-19.
Hello, everyone. My name is Congresswoman Robin Kelly, and I'm happy to open this conversation on Black maternal health with Dr. Veronica Gillispie-Bell and Olympian Tianna Madison. Complications from childbirth still claim far too many lives, especially among Black women. I have been working diligently to address this crisis, and I'm grateful to have so many willing partners in this fight for mothers and babies. I am proud that My Mama's Act provides for better data collection practices and bias training to support mothers and ensure that they get the care they need. I want to congratulate the Fibroid Foundation on their 10th anniversary. Their advocacy and leadership is paving the way for millions to live happier, healthier lives. As we acknowledge Fibroid Awareness Month, let us commit to making diagnosis and treatment of fibroids more widely accessible. Thank you for your tireless work. I look forward to speaking with you again.
I'm really happy today to be joined by 2 dynamic women who are working to raise awareness and make changes in the Black maternal health crisis. Dr. Veronica Gillispie-Bell, FACOG, Ochsner Health and Medical Director of the Louisiana Perinatal Quality Collaborative and Pregnancy-Associated Mortality Review for the Louisiana Department of Health, is an amazing and caring physician. I cannot highlight that enough. I've had the pleasure of speaking with Dr. Gillispie-Bell on fibroids advocacy previously, and I am so excited to speak with her today. And Tianna Madison, 3-time Olympian track and field gold medalist. She's a strong advocate for Black maternal health. Tianna has consistently supported the Fibroid Foundation's advocacy efforts, and I am so grateful for her consistent support. Ladies, thank you both for joining us today for this important and critical conversation. So I just wanted to highlight some statistics from the Centers for Disease Control and to define maternal health more succinctly. A maternal death is defined by the World Health Organization as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. So I think it's important for us to highlight exactly what a maternal death is defined by the CDC. And some statistics that are shocking but important for our readers and our listeners to know that in 2021, the maternal mortality rate for non-Hispanic Black women was 69.9 deaths per 100,000 live births, 2.6 times the rate for non-Hispanic white women. The rates for Black women were significantly higher than rates for white and Hispanic women, and there were increases across all categories and increases with maternal age. Disparities, which we will discuss, are at the center of this issue. To personalize health concerns, I believe, as a patient advocate, in hearing directly from the person affected by the health concern. It's the most impactful way to convey the enormity of the issue. Tianna, would you share any aspects of your birthing story or concerns as it relates to the maternal mortality crisis?
Absolutely. And again, thank you so much for having me so that I can continue to be a part of this important conversation. I knew the statistics about the Black maternity mortality rate before ever becoming pregnant. It actually factored into my calculus to not become a mother. My son had different plans for me, obviously. So when I realized that I was pregnant and that we would be having this baby, I used all my knowledge to try to prepare as best as I could. I went to the hospital with my advanced medical directive and my will in my bag, prepared for the worst. I went having fully educated my partner on how to advocate for me because Black women are largely not listened to. And so when I went into preterm labor at 26 weeks, we were already scared to death. We already were in an emergency situation, but at least we were prepared. But that education turned out to not immunize us from this crisis. And I proceeded to essentially, while trying to remain pregnant long enough for my son to receive steroids he needed for his lungs, should I give birth at 26 weeks, I proceeded to die slowly over 4 days while trying to remain pregnant with him. And my doctors were largely dismissive of my concerns that something was wrong with me because the baby's vitals were fine. And so they weren't really listening. They were really dismissive of me as long as the baby was safe. It took my partner essentially tapping the doctor, dragging her into the hallway and saying, look, I'm not leaving this hospital without her. Please take her out of this Trendelenburg position. She's dying, for them to actually pay attention. And just in time, because within 90 seconds of being laid flat, my heart rate tanked, the baby's heart rate tanked, and we were rushed into surgery for an emergency C-section at 26 and 4, setting us up for a 73-day NICU stay in the hospital.
Oh my goodness, that just gives me heart palpitations, and I had no idea. Were you inverted for the full 4 days?
Yes,
Oh
with
my
no
goodness.
food or water because you could go into surgery at any time and they didn't want to, they wanted to make sure that I was prepared for that. So it was a very difficult and terrifying time.
Wow. Well, thank you for sharing that very personal story, and I'm so grateful that you and your baby boy are okay.
Yeah.
Um, Dr. Gillespie-Bell, would you help us understand maternal mortality better and share your concerns on the current state of maternal health in the US?
Yes, it's really unfortunate. And I say that the state of maternal health in the United States is a public health crisis. And because it is a public health crisis, that means all hands on deck are needed to solve this problem and to improve these outcomes. When we look at the deaths, the rates, and it was just released in a JAMA article earlier this week, actually, the rate of maternal mortality has steadily been increasing over the last 20 years. And throughout all of that time, Black women have been disproportionately impacted, where we do see the rates, as you mentioned, 2.5 to 3 times higher for Black women dying during pregnancy or even in that time period after pregnancy. And we just are not seeing our outcomes improve. Now, there is work that's being done to improve the outcomes, but it's not being done at a pace that is not outpacing the maternal mortality rate. But it's really, really unfortunate that we are a country that spends about 17% of our gross domestic product on healthcare, but yet we have the worst healthcare outcomes of any high income country when we're speaking about our maternal outcomes.
That's incredible. And is there any information specifically indicating why the death rates almost doubled since 2018? Like, did COVID have anything to do with it?
There are a few things, and I say this from the perspective as the medical director of our maternal mortality review committee here in Louisiana. So in this role, we review all maternal deaths, and we look at not only the numbers, but we look at what caused the death. How can we prevent it? What is happening in our treatment landscape? What's happening in our social environment? So in terms of seeing that big increase in 2020, and the death rate did increase for all races, but disproportionately for Black women. We know that during COVID, there were a few things that happened. One, our healthcare system was disrupted. I know that this happened 3 years ago, and it's for some people it has become a distant memory. Being someone that was working in the healthcare system at that time, I feel like it was yesterday. To be able to get into care, whether that if you need to come through the emergency room, to get into a doctor's appointment, just depending on how your healthcare system was set up at that time. For individuals that were pregnant, it caused significant disruptions in care. And we know that anytime the healthcare system is disrupted, Black and brown women are going to be the ones that suffer the most. We already have decreased access to healthcare. So when the healthcare, or there are more barriers to accessing the healthcare, we are going to be disproportionately impacted. And so all of those factors are why we saw such an increased rate from in that time period in 2020, but also why our Black mothers suffered the most.
Well, thank you for clarifying that. Dr. Gillispie-Bell, I was really encouraged to hear about the Maternal Mortality Review Committee in Louisiana, and pleased to know that you're on that review committee. Does every state have a maternal mortality review committee, or is Louisiana unusual in that?
We're not unusual. We do have about a third of the United States does have a maternal mortality review committee that is funded by the CDC. And I think it's so important, really, that all states have a maternal mortality review committee. Again, this committee is not just made up of doctors like me. We have doctors, we have a patient that is on the committee, we have doulas, we have midwives, we have addiction specialists. We have domestic violence specialists. We have law enforcement. So we have all of these different entities that are able to review these deaths so that we can talk about areas of prevention. And a lot needs to happen in the hospital, but there's a lot that's happening outside the hospital as well. And that's why, again, we need all hands on deck. And so these maternal mortality review committees are really, really important for being able to identify where these changes need to be made. For us and under the CDC, when we review these deaths, we actually look up to 1 year postpartum. And while we are seeing a decrease in death in the hospital, we're seeing an increased risk of death for patients for dying from conditions related to the pregnancy after delivery to 1 year postpartum, but specifically in that first 6 weeks. And so what that tells me that there is work that, and I know of the work that we're doing, but there is work that's happening in the hospitals to start improving readiness and response and recognition. But we've got to start addressing social determinants of health that impact our ability for our moms to stay connected to care after they have been discharged from the hospital, really after they delivered. And then I think for us as a medical community, we have to start thinking about that postpartum period in a different way. I know for me, I was trained, we deliver our moms, they go home with their baby and their families, and then we don't see them until 6 weeks postpartum. There's a lot that happens between delivery time and 6 weeks. From a physiologic standpoint, from an emotional standpoint, from a support standpoint. And so we have to start thinking about that postpartum period differently. And that is what we are seeing from our maternal mortality review.
Social determinants of health is a key issue because I think that's the thread that relays the connection between the disparities that we see and how the community at large is really invested in the health of mothers everywhere. And I hope that there is more work that will look at those determinants to be able to make our community at large aware that we all have to play a part in making sure that these outcomes improve. And I'm glad that you mentioned doulas because they are just an invaluable resource to mothers and historically to caring for moms and their babies. Are there any warning signs of birthing complications that patients and providers need to be aware of? I know that you've written and spoken on this previously.
Yes, absolutely. We call it the post-birth warning signs, but these are things that can happen even during pregnancy. Those signs are headaches that are not relieved by Tylenol, blurry vision, bleeding that is more than a pad an hour. Also understanding and recognizing when we are having mood changes. And then just as a society, understanding that we are all somewhere on the mental health spectrum. It is okay to not be okay. We've got to take out the stigma and bias that we have around mental health conditions and mental health disorders. And so being able to recognize those signs and symptoms. And so it is important that we educate our mothers or our women that are going into birth. And the CDC Hear Her campaign has done a lot of work around that. But it's also about educating our support system. When you are that person, and I am saying this as a doctor, I'm saying this as a Black woman, I'm saying this as someone that's given birth. When you are that person that are experiencing some of those symptoms, you don't see it. It's your community that is, and your support system in your village that is able to recognize those symptoms to be able to get you into care. And again, that's why it's so important that we think about this as a public health crisis and that we are all educated on those post-birth warning signs.
You made a number of really good points, and I think it's important that we all have someone with us at our doctor's appointments and when we're admitted to the hospital, because it's hard to make decisions when you're not feeling well. It's hard sometimes to really comprehend what's taking place when you're not feeling well, and it can really put you in a vulnerable place. Even if you're a physician, I have physician friends who told me they've taken someone with them to an appointment to help them navigate that process. And stigma that you mentioned is really, I believe, at the root of so much, because we're not just dealing with the physical display of any particular symptoms. We're dealing with, and sometimes decades, if not centuries old stigmas around menstruation and women's health. And that is at the root of a lot of these disparities that then were impacted from here in 2023. And it's complicated, it's intense, it's unfortunate, and it's something that I'm really focused on speaking out against, that continuing to expand. Dr. Gillispie-Bell, sadly, not everyone will find a caring and talented physician like you, and our community members are desperately searching for someone like you in their communities. We get requests all the time. Do you have any thoughts on how we can address these significant disparities that exist?
Yes, thank you, first of all, for your kind words. So two things I would say. First of all, why do we have these disparities? It doesn't matter if we're talking about maternal health, if we're talking about the lack of options that are given to women that have fibroids. It doesn't matter what we're talking about in terms of disparities. It will always boil down to implicit bias and structural racism. And we see the structural racism play out in our social determinants of health. And that's why it's so important that we address those social determinants of health. About 60 to 80% of our outcomes are related to social structures, not just what we see in the office or just the clinical part of care. And so if we don't address that in the social determinants of health that have been built up in a way, and often a reinforcing way, to make sure that Black and brown people are suppressed, if we don't address those structures, if we don't address the implicit bias, then we're never going to decrease these disparities. And when I say implicit bias, there are things that are unconsciously a part of how we think about people that represent different ethnic groups, different racial groups. And it's an unconscious thought. And so it's not for anybody to feel guilty, because these are ways that our brains have adapted to the amount of information and the way we have to process information. But when you're in healthcare, that is literally the difference in life or death for someone. And so we have to understand that we have these biases, and we have to address them and start seeing individuals as individuals and not the groups that they may represent, and then assigning these stereotypes. I think the other part, because we do have bias, we have structural racism that is built into our healthcare system. I think it's so important for our mothers, especially our Black mothers, to have a doula as part of their care team, because that is that one other person that can help you advocate for yourself while you are in the healthcare space, when you as a mother may not be in a position to advocate for yourself. And they can really help you bridge that gap between what you desire, what you need, and that healthcare provider.
I couldn't agree more. And I think I appreciate your graciousness. I think that there is some conscious bias that takes place too, and definitely not with you, but I've experienced it. And, my expectation for everyone, whether or not you have a bias, is to just not bring it into the workplace, or find another career path where you're not impacting people's lives. I mean, I think that's really what it boils down to. And I appreciate you sharing that, because there's so many factors that impact healthcare and provider care, and that's one that we can address. There's so many variables that are unknown, but we know what's at the root cause there, and we know what it is the right and ethical thing to do in terms of medical care. I'm curious, do mortality rates occur more in first-time mothers? Or do we know?
Not necessarily. From the way we've looked at the data, it doesn't seem to be the parity or the number of births that you had doesn't seem to be a factor. What we do see as a factor is age. A lot of mothers are waiting until later in life to begin their family. And so we do see that as the age increases, then the rate of a pregnancy-related death increases.
Okay, thanks for that. Tianna, in retrospect, are there factors that may have made your pregnancy journey easier?
I've spent a lot of time thinking about this. I think because one of my natural inclinations, especially as a former elite athlete, is to be hard on myself. So I have reviewed this over and over. I think one, I was actively looking for a doula, but when you go into labor at 26 weeks, you kind of missed out on a good amount of time to get your care team together. I think that would have made it easier having had that in place much earlier. The reason I started looking for a doula after my physician tried to schedule a C-section for me before we had ever met for the first time, just over the phone. And then I knew that I needed to find someone else. I did everything else right. I maintained all of my prenatal appointments. There was a continuity of care. I began looking for birth centers and doulas and all those things, but time was not on my side. And the other thing, I think the strong Black woman trope backfired. I am strong because I've had to be, but the assumption that I was strong enough to handle what I was going through almost killed me. So I think giving myself permission to not have to be strong, to not need to suffer through something because struggle has been so much a part of my story. I think to just let myself be vulnerable and say, hey, I need this help, I need this support earlier, maybe that would have made the situation easier. But however, I accept no blame of my own. I accept no blame for, going into labor early and almost dying. I mean, it's a phenomenon, it's a crisis, an epidemic. But yeah, I think those two things could have offered me more support, and it would have felt easier to navigate.
Yeah, I'm guilty of that too. I mean, you proceed through life, you forge ahead, you press through certain things. You've watched family members do the same thing, and that press through certain really challenging physical issues, and it just becomes inherent to us. And you know, I completely understand that mindset. And I think, you know, as we experience life, which all of us, you know, do, it's a process of evolution, you know, where we learn more about ourselves and our circumstances. And I think your followers, of whom there are thousands, and our community loves you dearly, uh really cherish you and the vulnerability that you show, and you know, the fact that, you know, your beautiful team of friends who have birthed and had birthing complications are, as you said, elite athletes. And this maternal mortality crisis does not leave anyone out, sadly. And um, I think that, you know, I know that I and the Fibroid Foundation and our team and our community really embraces you through the whole process, you know, wherever you are. So don't be too hard on yourself, because there's no script to this life process. I say all the time. But thank you for sharing that. Uh, Dr. Gillispie-Bell, what final thoughts would you like to leave with our audience?
I think there's a few things. And Tianna, you actually hit on one of the things that I usually try to make sure that our moms understand. I want our moms to be empowered, understand that you are meant to be an informed consumer going into your healthcare. That means that your provider should give you risk, benefits, alternatives so that you can make a decision about your care together. We should be doing shared decision making, not making the decisions for our patients. The whole paternalistic way of practicing medicine is wrong. It is the way most of us were trained, but that is not the right way to give care. Care is something you do with a patient, not to a patient, not for a patient. I take that from Natasha Rouse, who is a patient advisor, and that I've done some work with in the maternal space. But I always want patients to know, and women to know, you are empowered to choose another provider. If the provider is not listening to you, if the provider is not giving you choices, you are empowered to choose someone else. And for that reason, we want to think about also preconception care. So if you, and I know Tianna, you weren't in this situation, but if you're contemplating pregnancy, shop around. Find a provider that fits with you, that understands you, that is going to honor your wishes and is going to hear you. That's not going to make you feel stupid when you ask questions. That opens that door for you to be able to ask questions. I think that is so important, that you have that partnership. And then just the other thing, and we talked about it already, is just that we all are aware, whether we are women going into childbearing and we plan on having children, or we are friends of someone that's going to have a child, or a partner to someone that's going to have a child, that we understand those post-birth warning signs, and when to come to the hospital and when things are not okay. And then knowledge is power. So having that knowledge to be able to advocate for yourself in the health space if you don't have someone that is able to advocate for you.
As you were speaking, I felt like I wanted to like print that list of action items. Thank you for that. Dr. Gillispie-Bell, how can our audience follow you?
So you can follow me on Twitter at NOLA OBGYN. You can find me on Instagram, the Gillispie 1908 Gillispie. Everybody always spells it wrong. 1908 on Instagram. I'm on LinkedIn as well. Social media is the best way to find me and to follow me.
Awesome. Thank you for that. And Tianna, I really want to offer my condolences at the loss of your dear friend, Tori Bowie. That touched us all. And you and Allison Felix have made impactful statements on your birthing stories, which we appreciate. And the fact that 3/4 of your Olympic gold medal team has been impacted by birthing complications, which gives me pause, definitely. Would you like to share any upcoming activities that you'll be participating in to shed more light on this crisis?
So the death of Tori was really devastating and almost destabilizing. And at the same time, I would be remiss to not take advantage of the eyeballs and the ear that such a sensational story gave to this topic. And so in addition to doing the media rounds and things like Good Morning America and NBC Nightly News and all of those things, I have more panels coming up to talk about this issue. But what I don't want is to just be telling my story without action steps, without constructive recommendations. And that's why I am so honored to be on this panel, especially with Dr. Gillespie, because it's not uncommon for us to have this experience. So we all have stories. So what's the next step, right? So what do we do about it? And so one of the things that I want to do is, in addition to being the Olympian who has also lived this experience, and that comes with a certain platform, to be able to use that to have these discussions, but to also not scare the women who aren't Olympians, because of what I've also heard is, wow, if this could happen to Serena, Beyonce, these Olympians, I don't stand a chance in the healthcare system. And I've been thinking about this more and more over the past couple of weeks, since talking about it almost daily, that I don't want us to stop reproducing because of this fear. I want us to continue to try to bring forth life and contribute to society, because Black women are magical beings and we get things done, and there needs to be more of us, and we deserve to live, to raise our babies, and to be protected. So a lot of my future endeavors will be around that. And like the doctor said, it's really about collaboration and education and getting the care team together. And if you're in a position where your healthcare system is not the way we would want it to be or ideal, then the care team becomes very, very important. And I just kind of want to encourage grassroots efforts. Like, until the system can be dismantled, this is the game we're playing, and this is how we play to win. And that's what I'm shifting my focus to moving forward.
Now, that's a quote. I will be revisiting that one. Thank you so much, Tianna. And where can our audience find you?
So I'm most active and most accessible on Instagram at tianna.t.madison.
Thank you very much. Well, thank you both so much. This has been such an enriching conversation. I do feel empowered, and I fully agree with all of the recommendations that you both have shared. And I look forward to carrying this conversation forth in an actionable way, as Tianna referenced, so that we can all take charge of our health care. Thank you so much for your insights today. I know this is going to be helpful to so many. Be well, everyone. Thank you so much for joining us today for this conversation on Black maternal health. If you are facing a menstrual health challenge, you don't have to make the journey alone. We encourage you to reach out to us at fibroidfoundation.org. Please join us on July 27th for an important conversation on fibroids and menopause. We look forward to continuing to share informative and enlightening conversations that help change the narrative surrounding menstrual health. Together, we are making a difference. Thank you all, and be well.